between 2 to 4 times a year for an epidural steroid injection. I think if I'm doing it every 2 months, that's too frequent in my opinion.
Okay, and for the patients who will say after a couple of years, it looks like the inflammation is not being adequately managed by these injections, what's sort of the next step for those patients?
Depends what's causing the pain. So if it's failed back surgery syndrome and they don't have any other options, the injections aren't giving them the efficacy that they're looking for for adequate duration and time. Next step for us would be something like a trial of a spinal cord stimulator. Patients that have had epidural steroid injections, essentially they have a virgin back, they have a herniated disc. The herniated disc is pinching the nerve and their classic kind of radicular pain, and it's not improving. I don't like hang on to a patient and just keep injecting them if they're not improving. So at that point, I might refer them to a surgeon and give them a surgical option to say, this might be something you want to look at. If it is clear-cut radicular pain, meaning pain going down the leg or the arm, it could be something that, if it's pure back pain, it might be worth looking at other things than steroids, like is this acetogenic pain? Is it SI dysfunction? Is it myofascial pain or muscle spasm? So we'd start looking at, why isn't an epidural providing them long-term relief? And if it's because of radicular pain or a pinched nerve, that's usually the next step would be a surgeon. If it's back pain, then we're, further examining is this Facet, SI, other pain generators. If they're getting like 4 to 6 weeks, that I could inject you in the butt with a steroid and you'd probably get 4 to 6 weeks of relief just from the mechanism of the steroid. So if I'm only seeing short-term relief, I need to look at, okay, are we doing the right injection in the right place?
Okay. Just because you mentioned the spinal cord stimulators.
Yeah.
So one of the challenges that some of the physicians who are putting in, hundreds of these things a year is a concern about the referrals and that there's a limited knowledge from the base of the physician, the primary care physicians, as well as the patients of the options of the spinal cord stimulator. Have you found that to be true in your practice, or is the fact that you have this sort of contained referral network, does that alleviate some of the ignorance around the technology?
Well, I think that, stimulators have been around for 50 years. 50 years. The technology was started. And so it's one of these procedures that, it did get utilized prior till 2013. In 2013, CMS came in and slashed reimbursement 78%, which for the therapy as a whole, I think was very positive. Because what it did away with was the fiscal aspect that was driving a lot of clinicians to either refer patients or consider spinal cord stimulation. I think when you pull out the aspect of, I could do this and it's going to be a $4,000 to $6,000 payday for 15 minutes, all of a sudden you have a lot of patients that are getting trialed. All of a sudden you have patients that are getting 3 or 4 leads shoved in their back, to rule out spinal cord stimulator. I've seen some really atrocious things. And so I think that floating around in the community, there's been some negative connotation, not just with spinal cord stimulators, but about interventional pain physicians that have been driven previously by, maybe the wrong drivers. And now with the change in reimbursement, I think maybe you're seeing a better patient selection. And with that, I do a lot of education where I'll meet with primary care providers,